Welcome back to my channel. My name is Dr. Anwar Youssef Dunbar, and this is Big Discussions 76, Science and Technology. First of all, please like this video, please share it, and please subscribe to my channel. Well, I haven't watered this channel in a little bit. I've been putting in a lot of work over on the original channel, and with the Michigan football season coming up, I've been pumping a lot of content out over on that channel, in anticipation of my maize and blue taking the field. But I wanted to come back over here and create some more content for the science channel. There are a lot of things that are in preparation right now, and a lot of things that are a lot of exciting things that are going to come here on Big Discussions 76, Science and Technology. So stay tuned. There are some exciting things in the works, and some exciting partnerships and collaborations that are in the works. One of them involves the Lioness, so she's going to be, look for us to collaborate some more, and there are just some exciting things on the way. So I'm going to read another article here in the voiceover format, like my hero, BGS, and I will be showing my face again at some point. I realize that I've done a lot of the voiceovers, but these are agile, and they're high throughput, as we say in the science community, and they're fun. So this article is from CNN of all sources, but I think that this is an important topic. And I don't think that this one is as politically slanted. So I'm going to present this one. And this is back in the coronavirus space, and it's thus very relevant for what's going on now. And it's very relevant because there is tremendous uncertainty regarding what's going to happen with the coronavirus as we enter the winter months. And even though this article, it's dated September 17th, so it's almost a month old, I'm seeing a lot of reports springing up on my smartphone and in my Yahoo newsfeed and everywhere about here in the United States about infections starting to ramp up. So this is something for all of us to be aware of. So this article is entitled, "The World Health Organization Warns of Very Serious Situation in Europe with Alarming Rates of Virus Transmission." So going back to, we know that the virus originated over in China. And even though the Trump administration shut down travel from China, what we know is that the travel from Europe wasn't shut down in as a robust way. So that wasn't regulated as much at first. And it's been speculated that there was a whole series of mutations taking place over in Europe. So they may have their own form of the virus over there. So, which has accounted for a lot of their deaths. So, and the virus mutating is very much a concern all around the world. So this is from September 17th, and it was written by Laura Smith Park and Vasco Cotovio. The World Health Organization has warned that coronavirus cases are surging alarmingly in Europe as a very serious situation unfolds across the continent. As COVID-19 infections spike to record numbers, European governments are imposing strict local measures and weighing up further lockdowns in a bid to halt a second wave of the pandemic. But the WHO Regional Director Hans Kluge said at a Thursday news conference that the increase in cases should serve as a warning of what is to come. Weekly cases have now exceeded those reported when the pandemic first peaked in Europe in March, Kluge said. Last week, the region's weekly tally exceeded 300,000 patients. More than half of European nations have reported an increase of more than 10% in new cases in the past 2 weeks, Kluge said. Of those, 7 countries have seen newly reported cases increase more than twofold in the same period, he said. In the spring and early summer, we were able to see the impact of strict lockdown measures. Our efforts, our sacrifices paid off. In June, cases hit an all-time low. The September case numbers, however, should serve as a wake-up call for all of us, he said. Although these numbers reflect more comprehensive testing, it also shows alarming rates of transmission across the region. While there was an increase in cases in older age groups, those aged 50 to 79 in the first week of September, Kluge said, the biggest proportion of new cases is still among the 25 to 49-year-olds. Countries across the continent have been easing lockdowns and reopening their economies, but governments are now scrambling to avert further outbreaks. This pandemic has taken so much from us, Kluge said, citing the nearly 4.9 million recorded COVID-19 cases in Europe and more than 226,000 deaths. And this tells only part of the story, he said. The impact on our mental health, economies, livelihoods, and society has been monumental. So in terms of new restrictions, in France, COVID-19 hospitalizations have risen in recent days in large cities such as Paris, Bordeaux, and Marseille. Earlier this year, the first coronavirus wave spiked fast in France, but it was cut short by a strict nationwide lockdown. In a total of more than 31,000 people, more than 31,000 people died there from the disease out of more than 443,000 cases, according to Johns Hopkins University. Now the number of new infections is rising fast. A record was set over the weekend with more than 10,000 new cases in a single day. The number of clusters has been rising steadily and, more worryingly, nationwide. The number of people in intensive care has risen 25% in the past week. Cases in the United Kingdom, Germany, Spain, and Italy have also increased. New restrictions were imposed across England this week, barring people from meeting socially in groups of more than 6 of all ages, indoors and or outdoors. Scotland and Wales have also tightened their social distancing rules. From Friday, even stricter measures will apply in the northeast of England amid a concerning rise in COVID-19 infection rates there, UK Health Secretary Matt Hancock announced in Parliament on Thursday. The measures include a ban on socializing outside households or support bubbles and a mandated closing time of 10 p.m. for all bars, pubs, restaurants, and leisure centers. They will apply to 7 areas, including the cities Newcastle, Sunderland, and Durham, and will affect more than 1.5 million people. Hancock stressed the need to take immediate action against the virus with winter approaching. At least 41,773 people have died with coronavirus in the UK, according to the Johns Hopkins University, the highest toll in Europe and 5th largest number of any country in the world. The UK government has come under pressure over recent failings in its coronavirus testing system, with some people, including healthcare workers, experiencing difficulty in accessing tests or being directed to test sites far from home. Prime Minister Boris Johnson defended Britain's coronavirus testing record Wednesday, saying it compared favorably to other European countries and that recent problems were due to a colossal spike in demand. Authorities in the Spanish capital of Madrid are now to announce new coronavirus restrictions on Friday as the country also responds to an uptick in the number of cases. Spain now recorded more than 30,000 deaths since the start of the outbreak, with more than 600,000 total cases. Madrid accounts for approximately a third of all new cases, according to data from the country's health ministry. The president of Madrid's regional government, Isabel Díaz Ayuso, has suggested that migrant populations are partly to blame. The outbreaks are partly due to the way of life of Madrid's immigrants and the population density of these districts, she said Tuesday. It is a way of life in Madrid. Meanwhile, German authorities have imposed new restrictions and ordered more testing in a popular Bavarian ski resort after a coronavirus outbreak that has been linked to a U.S. citizen working at a lodge operated by the U.S. Army. The state prosecution service in Munich said it had launched an investigation into the American who may have caused the surge in cases. New regulations imposed in the town of Garmisch-Partenkirchen over the weekend mean local bars will now close at 10 p.m. Parties are limited to 100 people, down from 200, and groups eating indoors are capped at 5, down from twice that. In neighboring Austria, Chancellor Sebastian Kurz has warned citizens that more cases are on their way. "We are at the beginning of the second wave," he tweeted Sunday. "We are facing difficult months in the autumn and the winter. The number of infections is increasing from day to day." Kurz asked Austrian citizens to continue to adhere to all virus measures and reduce social contacts. Meanwhile, countries, including Greece and Croatia, largely spared by the first wave, saw fast case number rises in August as tourists took summer vacations following the reopening of Europe's internal borders in June. Klug urged an amplified collective effort by all European member states for the sake of all European member states as he addressed the media Thursday. The response to the crisis has been very effective whenever the actions were promoted and resolute, but the virus has shown itself to be merciless whenever partisanship and disinformation prevailed, he said. Where the pandemic goes from here is in our hands. We have fought it back before, and we can fight it back again. So again, this article is about a month old, but I think it's highly relevant even here domestically in the United States in terms of reports I've been hearing about infections increasing, and then also for what we can expect potentially in the winter months. I'm not sure if I pronounced this gentleman's last name correctly in terms of it being Klug or Kluge, but I just wanted to shoot a video on this. Please let me know if you have any questions or comments in the comment section below. Please like this video, please share it, and please subscribe to my channel. Big Discussions 76 Science and Technology is right around 460 subscribers, I believe. The next milestone is 500. please help push me up there. And look out for future content. As I said at the beginning of this video, there are some very cool things in the works, and so stay tuned. And as always, remember that your attitude determines your altitude. Take care, and I'll talk to you the next time. Bye-bye.